Hi, we are here today with Dr. Scott Eshowsky. He is a primary care physician with Beacon Medical Group. Dr. Eshowsky, thanks for joining us today.
My pleasure. Thanks for having me.
So today we're talking about sore throats, fever, cough. How do we know if we have one of these? When it's allergies, when it might be an upper respiratory condition, or when could it be COVID? Can you help us out?
Sure. It's a great question. It is a timely question and one that is probably on everyone's mind as we are now in the thick of the summer months, and we've got all kinds of pollen and allergens in the air that we may um, fall victim to. And so sometimes those symptoms can be confusing because there is a lot of overlap between them. And typically, seasonal allergies are associated with a lot of upper respiratory symptoms like a runny nose, watery, itchy eyes, a lot of sneezing, itchy nose, sometimes a cough. But usually those aren't associated with much in the way of fever or a whole lot of ear ache or pain. Now, sometimes people get so congested they may get popping in the ears. Um, but a lot of times we don't really feel terribly sick. We don't feel achy. It doesn't make us terribly sluggish. And again, it shouldn't cause fevers. But sometimes the symptoms get confusing. And if you ever have questions, it's always best to get in touch with your doctor to make sure something else isn't going on. On the flip side, upper respiratory infections, that's essentially what COVID is. Now, COVID can cause both upper respiratory and lower respiratory symptoms in your lungs, but a lot of us with COVID just get kind of cold-like symptoms, and sometimes they're really hard to tell apart just based on the way that you feel. So again, it's important to get in touch with your doctor and find out if it's appropriate to get tested for COVID, or if they think based on your symptoms, maybe something else is going on and we need to do more of an evaluation.
It never hurts to check, that's for sure. And also, now that we're into the summer months, Lyme disease is something else I wanted to ask you about because I don't know if there are a lot of symptoms that overlap there with COVID or flu and Lyme disease. What can you tell us?
Sure. So Lyme disease is definitely more prevalent this time of year and even into the fall. Lyme disease is caused by deer tick, which we do have deer ticks in our region that some of which are infected with Lyme disease. And so Lyme disease, though, at least the way we feel from symptoms is quite a bit different from COVID. The one thing that they do have in common is that usually Lyme disease will cause a pretty high fever in over 90% of patients. The other things that are really common with Lyme disease that we don't really see with COVID is a pretty characteristic rash. Usually at the site where the tick may have bit you, you'll see a pretty large reddish rash, sometimes with kind of different patterns of clearing in that rash. And other times, as it gets further along, you may even see other spots in different parts of your body. Another thing that we see with Lyme disease is a lot of joint pains. And so while sometimes with COVID or other respiratory illnesses, we may feel kind of generally achy, but a lot of the symptoms with Lyme really settle more in the joints as opposed to the muscles. And those are kind of the big distinguishers between them. So it's always important to be on the lookout. Sometimes we may have a tick bite that may go undetected for a while, and we may not even realize that we had one. So anytime we get a fever, especially in the summertime, it is important to at least think about it as a possibility.
And again, contact your doctor if you have any questions. So
Yep.
now that we're again, we're talking all about summer here, but we're spending time outdoors. We're wanting to get outdoors more. I'm hoping that you can help us out with some reminders of how to keep safe when we are outdoors.
Sure. Yeah, this is, lots of people are excited that the weather is warmer and want to venture outside. A lot of us have been doing a great job staying indoors and staying away from other folks. And it's really easy to get excited and go outside and forget to put on sunscreen, or forget if you're going to be out in the evening or early morning hours to put on insect repellent. I know it's going to be hot this weekend and throughout the summer. But if you are going to be out, especially in areas where there are a lot of mosquitoes, wearing lighter layered clothes, but long sleeves or long pants is usually best. I know that's not always possible, and if it isn't, then definitely use some insect repellent that contains DEET is one of the most effective chemicals to keep insects or to keep mosquitoes off of us and away from bites.
And sunscreens, what do you recommend there?
Sunscreens SPF of 30 or higher is best. They do, obviously there's a lot of different brands. Some of them are a bit more water resistant than others. So if you are going to be swimming or doing work where you're sweating a lot, that just determines how often you should reapply, but it's always best to reapply frequently, and as much as you're able, try to stay in the shade under an umbrella or a tree if possible, and try to minimize as much sun exposure as you can.
And hopefully this will keep us out of the doctor's office,
That's
right?
right, right, that's right.
Thank you so much for your help today. Good talking to you.
Oh, you're welcome. Thank you.